Well, thank you for joining us. Unfortunately, this is probably where the pleasant part of the press conference ends because, frankly, Minnesotans are in a healthcare crisis right now, and we need to find solutions, and we need to find them very quickly. We have been pushing Democrats to join us in finding solutions to this problem for some time, and really have not met any cooperation from their part in helping us solve these problems. 2 years ago, Democrats stood at this podium and declared victory because Minnesotans supposedly had the lowest premium increases in the country. 2 years later, Minnesota families are facing some of the highest increases in the country. Individual marketplace in Minnesota is on the brink of collapse. We need to make sure that Minnesotans have real solutions to provide health insurance and health coverage for their families and can do that in an affordable way. The price hikes that were announced recently of 50 or 60% or more are absolutely unaffordable for Minnesota families. And this is really unacceptable. I obviously wrote a letter to the governor about a week ago asking for him to take quick, swift action and to work with us to find solutions so that Minnesotans can find affordable health coverage. I have not yet heard back from the governor. And we are concerned that Democrats don't seem to even be willing to admit that there's a problem with MNsure. Obviously, for folks that can find health coverage outside of the individual marketplace, they face the potential of paying penalties for not buying inside the marketplace, even though those plans outside the marketplace could meet the needs of their family and meet the needs of their family budget. We think those things are absolutely unacceptable, and we need to find solutions to make sure that folks can purchase products that meet the needs of their family and are affordable for their family. So Joyce is going to talk a little bit about some of the things that we've done over the last couple of years to try to make this situation better. Joyce.
Well, thank you, everyone. You know, for the past several years, Republicans have worked to begin to address the MNsure disaster that the Democrats created and to make health care more affordable for Minnesotans. We successfully passed a waiver request that Governor Dayton has yet to follow through on to allow access to tax credits while bypassing the MNsure exchange. Another waiver request, which the Dayton administration has put minimal effort into, would have allowed Main Street businesses access to tax credits while bypassing the disastrous small business MNsure exchange. There seems to be a pattern in the Dayton administration of not following through on waiver requests that have been signed into law by the legislature that would benefit Minnesotans. We also passed legislation originally authored by Representative Jason Rarick to eliminate medical assistance liens on seniors. Legislation provides stronger accountability, including requiring meetings of the MNsure Executive Steering Committee to comply with the state open meeting law. We passed legislation on telemedicine expansion that will increase access in rural areas, and legislation adding Minnesota to the Interstate Medical Licensure Compact, making it easier for doctors to come to Minnesota. Unfortunately, the Democrats have blocked most Republican-led efforts to tweak and reform MNsure since it was approved and passed only by the Democrat-controlled legislature 3 years ago. And we believe that an issue as important as health care, Democrats should have worked with us to find a balanced, compromised bill rather than forcing through this partisan disaster. This past year alone, Democrats blocked bills that would have helped ease some of the pain caused by rising health care costs. And some of these bills include transitioning Minnesota to the federal exchange, which would save Minnesota millions in overhead costs and improve user experience, provide additional state tax premium relief, as well as an effort to accelerate the sunset of the sick tax, which is set to expire in 2019, and reduction in the premium withhold tax that included benchmarks, performance benchmarks, to force MNsure to improve its technology functionality. And with that, I'll turn it over to Chair Matt Dean.
Thanks, everybody. President Obama at the federal level with Obamacare and Mark Dayton in Minnesota with MNsure have proven beyond a shadow of a doubt that one party cannot fix health care or attempt to. MNsure in Minnesota has just made things worse. It's made things more unaffordable, and it's hurt people. And we've heard from people all across the state over the past 2 years about their premiums going up, they're losing their insurance, and they can't see their doctor. We need to come together to come with common sense solutions to not only address a long-term solution so that Minnesota can once again lead and not follow the rest of the country in healthcare, but that we can address emergency situations that people have right now with MNsure and specifically within the individual market. We need to lower cost and we need to produce more options for folks. We're going to put some things on the table that we can do right now. And we have some ideas that we can move ahead that really do address the needs of families across the state. And this is middle-class Minnesota, by the way. These are not people on public programs. They're not people protected by a union or by a big company or by the government. These are shopkeepers. These are farmers. These are people who pay the bills and play by the rules. We need to reduce the MNsure tax. We could do that immediately and save $22 million. We could use $35 million left over from the MSHA fund to provide immediate premium relief for Minnesotans and middle-class Minnesotans that are going to be struggling to pay their bills. We can seek a waiver to encourage the federal to waive our tax penalties for people who are going to get whacked by the penalty stick on this thing. We want to end surprise billing, so when you go to the doctor, maybe your surgeon is covered under your plan, but your anesthesiologist is out of network, so you get whacked again with that bill. We want to be able to end that. We want to get rid of MNsure. We want to be able to get this behind Minnesota, this failed experiment behind Minnesota. And if we can't do that immediately, we want to be able to allow people to push the panic bar, as the majority leader said, and allow people out of MNsure who've been trapped within it. That will allow people to buy private health insurance on the market and not have to do that within the MNsure system. Ensuring that people have more choices at lower costs is absolutely critical. I was in Henning, Minnesota on Monday night, and I spoke with a guy with 3 kids. He's got $1,100 a month premium, and he's got a $13,000 deductible. And he would love to be able to renew that plan. He can't renew it, and he can't get any plan to cover his kids with what he needs. We've got people with a 50% increase on top of that. We've got a woman that I spoke to in August. Her son has 2 brain tumors, and he's getting treated by a team of doctors at the Mayo Clinic. Right now, we're saying under the current plan that was unveiled on Friday, if you live in greater Minnesota, you have no opportunities to get to the Mayo Clinic or the University of Minnesota under any plan. And that's not okay. That's not Minnesota. Their only option is to get divorced or quit their job or cheat the system to get on Medicaid. That's not Minnesota. That's not an option. So we need more choices and we need some lower cost, longer term solutions, but we also need to address this immediately. And Chair Davids is going to talk a little bit more about the meeting today.
Thank you, Chair Dean. I invite you all to the meeting at 2 o'clock on the LOC, Legislative Oversight Commission on MNsure. Part of fixing the MNsure crisis involves bringing more accountability to MNsure. If Governor Dayton won't join other blue states like Oregon, Hawaii, and Maryland, not exactly your bastions of conservatism, in moving to the federal exchange, he owes it to taxpayers to increase accountability. In fact, as you know, just yesterday, Kentucky has gone to the federal exchange, and Kentucky was held out there as the best exchange in the country. They're not there anymore. We need benchmarks put in place to require MNsure to finally deliver on its core functions. If they can't meet these basic benchmarks, we should look into recouping the money we've wasted with the technology vendors and demand answers why $400 million isn't enough to achieve a functioning website. MNsure's inability to process enrollments has meant millions in additional costs for county taxpayers because counties are forced to hire people to manually enter data from MNsure. I believe Hennepin County hired 95 employees, something like that. The 50 to 60% increases Minnesotans are dealing with are only the tip of the iceberg. MNsure and Obamacare are resulting in millions of additional hidden costs to governments school districts and Main Street businesses that are passed on to families. As chairman of the House Tax Committee, I would be remiss not to mention something about taxes. I'm mystified by the insistence of my friends on the other side of the aisle that we can solve this mess by simply increasing taxes. To me, this is a very simple situation. Minnesotans are paying too much for health care. Extending taxes to individual insurance plans and extending the tax on doctor's visits won't do anything but take more money from families and put it in the hands of government. That is the exact opposite approach that we must take. There are just some of the these are just some of the topics we're going to cover today in the Legislative Oversight Committee. I look forward to having a chance to visit with Commissioner Rothman, I believe, is going to be there, and get some of his thoughts and ideas in hearing their thoughts on how we fix this. Now let's just, in closing, let's just do some simple math here. Blue Cross has lost just short of $500 million in the last 3 years. They pulled out of the individual market, and who could possibly blame them? 103,000 Minnesotans with no health insurance. Health Partners has pulled out of every county except the 7-county metro and 2 counties around St. Cloud. That has 50,700 people that must find coverage. So the situation we have is we have to find coverage for 153,700 people with about 19,000 open slots. Now to me, I'm just a poor farm boy, and that's like trying to suck a watermelon through a garden hose. How in the world can we take 153,700 people, fit them into 19,000 open slots? How does that work? With MNsure that can't properly handle the 63,000 that they have. How do we do this? Well, we're going to try and get some answers starting at 2 o'clock. Mr. Speaker.
So obviously, I think you can see from our perspective, this needs immediate action, and we are ready to step up and put in place some solutions that can help immediately, but also work towards long-term solutions that will help Minnesotans find affordable health coverage. This is a crisis, and we need to make sure that Minnesota families have access to health coverage. I remember the debates on the House floor when Democrats promised that this was going to reduce costs and increase access for Minnesotans to health coverage. And I think now we can all agree that it has done exactly the opposite of that. Health insurance coverage for Minnesota families through MNsure has more than doubled, probably tripled in many cases. And the access now is far less. In fact, we can't figure out how the Minnesotans that need the coverage are going to get covered through the plan the Dayton administration and the Department of Commerce have approved. So this is a troubling situation, and Minnesotans need access, and they need answers now. So with that, we'll take some questions.
Understanding that this is urgent, are these the solutions that can actually help all of these people whose rates are going up between 43 and 67%? Will this help them before they have to pay these costs?
Well, they have to have a plan to buy. Even if they can afford a plan, they got to have a plan to buy. Allowing people out of the MNsure system so that they can go to their insurance agent and say, can you help me again, like you did before? What kind of products will we have? And then allowing more products to be sold in the state so that they can have more choices. In Greater Minnesota, unless you're very lucky and call in on the first day, you're going to have one choice. And that choice is not going to allow you access to an emergency cancer center in the University of Minnesota or Mayo or outside of a narrow network. So we really do need more choices. What was approved on Friday does not work for Greater Minnesota. It does not work.
Yeah, I get that, and I'm not asking precisely enough, I guess. Does this need legislative action? Do you have to meet in order to do this? Can this be done without that, by executive action, by some sort of regulatory means?
Some of the solutions would not require that Governor Dayton can do with the authority that we voted for to give him already. Some of the solutions would require that the legislature meet and pass and approve. The open enrollment period ends right as we're coming back into session, so that's what creates the problem.
If I could, to that point, the problem that we need to talk about a little bit, especially in outstate Minnesota, is there will be no plans on MNsure that have open network access. So in other words, there'll be what some of my friends on the other side of the aisle have called junk insurance, HMOs. That's not me, that's what some have said. But you lose now all these people have just lost their doctor. In my area, the biggest provider, believe it or not, in my area is probably Olmsted Medical Group, okay? They don't, a lot of people, go to the mother flagship of Mayo in Rochester, but Olmsted Medical, and they're not in the Blue Plus plan. They're not in it. So we have no plans in outstate Minnesota where you can go where you feel you need to go. So choice has been taken away there. And with the massive premium increases, I talked to a guy yesterday, it's gonna be $2,300 a month for him and his wife, $2,300 a month with like a $13,000 deductible. So we're forcing people either into bankruptcy or dropping their policies and becoming criminals. So that's not a very good choice to have. You're gonna break the law by not having coverage, or you're going to file bankruptcy. That's where we're at. I believe it's an emergency situation, as does Commissioner Rothman.
So the big problem with the insurance, people say about the insurance market, in the individual market in Minnesota, is that there's too many sick people and not enough healthy people, which means that the insurance companies have been losing money. And I don't see any of these things that are directly targeted at affecting the composition of the individual market. There's something that would save consumers money and would change the regulation. Is there anything in here that would actually help restore that balance so that insurance companies could break even by providing insurance to this 5% of Minnesotans?
Well, one of the things that we can do is provide more options for people, and by providing more plans that can be sold in the state of Minnesota, they could provide them at a lower rate. And also, if we have the pool of individual market can grow competitively, that will also help. But when we allow people to get out of the MNsure system and allow people to be able to purchase something online, that would be, or with their insurance agent, that will help bring down costs. But also, we have to say, why is it more expensive in the state of Minnesota to buy insurance than in neighboring states, when in Minnesota we already have a 2% provider tax, which is over $500 million a year pumped into the system to lower costs already. How can it possibly be that we're that much more expensive than neighboring states for individual policies?
Speaker Daudt, the DFL issued a press release even before you started here. They say after 2 years of control of the Minnesota House, why is this the first time Republicans are presenting a plan?
Well, I will, in a moment, invite Joyce to come back up and read through the list of the things that we have done and the things that actually got signed into law and the things that Democrats blocked over the last 2 years. I think that's an embarrassment. And I think former Speaker and Minority Leader Thissen ought to be embarrassed to even issue something like that. Not a single Republican in the legislature voted for MNsure, and we have been raising red flags and calling for action since this began. And if you need a reminder of what side of this issue everyone has been on, go back and watch the debate on the House floor when this was passed. And we warned of all of these things, and all of them were ignored. And today, it's not us and it's not Democrats that have paid the price, it's Minnesota families. And my challenge for all of you is the next time you see a Democrat, ask them if this is a crisis for Minnesota families. Ask them how they're going to provide health insurance to the 130,000 people that aren't going to fit into these policies that have been capped. And that plan, by the way, was approved by the Dayton administration and by the Department of Commerce. They literally approved a plan that will deny coverage to 130,000 Minnesotans. And if they aren't willing to step up to this microphone today and say that there's a crisis and a problem and that they're willing to work with anyone who will work with them to solve those problems, I mean, it's literally laughable that they would try to blame this on us. Not a single Republican voted for it, and they've ignored every warning call that we have made to try to get this fixed. And who's paying the price? Minnesotans, who now not only can't afford their health coverage, won't even have an option to be able to buy health coverage. The time for action is now, and Joyce can review the list of things that we have done in the last 2 years.
I will, and like Speaker Daudt said, that statement is outrageous. The Democrats need to own this. We tried very hard. We had probably 100 amendments that Chair Dean and Chair Davids worked on. I remember having a conversation in committee where we talked about how, just one of the points, how outrageous it was that no one that had insurance experience and no one that had medical insurance or medical experience could be on the MNsure board. That was just one of the many, many things we talked about. We took that, we had hours of testimony on that, and we I don't know how many of Republican members stood on the floor and predicted, it was like we were prophets, we predicted this whole thing was going to happen. So for Minority Leader Thissen to blame Republicans for this, no, he needs to own this. This was his legacy, and this is what he's created. And now we have tried very hard to fix some of the wrongs that have been foisted upon Minnesotans. I read through some of them before, but I mean, just the Dayton administration not following through on the waiver requests that we passed, the 2 waiver requests for individuals and for small businesses. We've done a lot, as I listed off before, with Jason Rarick, Representative Rarick, eliminating the medical assistant liens, the stronger accountability measures so that we can actually see what's going on the MNsure executive steering committees, the telemedicine expansion, and again, I mean, we've talked about some of the things the Democrats have blocked, and I think foremost amongst that is transitioning Minnesota to the federal exchange. That alone would save millions in costs. The fact that we've spent more than $400 million, almost $500 million in this failed MNsure system, it's a shame that Representative Thissen would blame us and not take responsibility for his and his party's actions.
Chair Dean, if I may follow up on a question from Pat back there. Is there any legislation that you can pass immediately when the session starts that would provide relief or help more rural Minnesotans get into a plan?
Right, and I think focusing on Greater Minnesota is really it. Once again, Greater Minnesota is being treated like Lesser Minnesota with this plan that was approved on Friday. The problem is that open enrollment period ends just as we're coming into session. So we're going to be missing the boat because this plan, as it is approved, does not work for Greater Minnesota as Chair Davids and the Speaker outlined. So there's for that plan that is on the table now, I would submit does not work. It does not work for Greater Minnesota. That cannot be approved as it is without making it more fair for people who live outside of the metro area at least, and to be able to provide more options for middle-class families. And this is middle-class Minnesota that is in a vice already, and this is making it completely unworkable for Minnesota families. As they find that out, that is going to cause an immediate problem. They're getting the letters right now in the mail. The providers are getting letters in the mail saying you can't see the people you see right now. The patients are getting letters in the mail saying you don't have the policy you used to have. And when they go to sign up again, they'll find out that they can't see their doctor in Greater Minnesota and they can't get to the doctor. So we need to be able to provide immediate access, allowing people out of MNsure and to be able to buy products immediately through a waiver to call their insurance agent that they were able to do for the past 50 years that they might know of the same agency and be able to get some immediate help. That's what they need. They need some peace of mind, and they need some products that they can buy immediately.
So let me ask you the question that essentially the Star Tribune editorial board asked this morning. Does there need to be a special session before January in order to fix this problem?
Well, I think the governor has said that he has closed the door on that, but I would say that the Southwest Light Rail is not an emergency. This is an emergency. And if he's going to the same places around the state and talking to the folks that we are, he would certainly see that it is, and I know the Speaker would probably want to address that directly.
Yeah, I think, obviously, there has been a lack of action on the part of the Democrats. I received a letter, I don't know if it came late yesterday or early this morning, from Commissioner Rothman, kind of questioning why we haven't done anything for 2 years. Well, I would invite him to review what we actually have done. And in that same letter, he said that the action that he has taken is he sent a letter to the feds 10 months ago, and he's waiting to hear back. I'd like to know how Minnesota families feel about the commissioner waiting to hear back from the federal government about this crisis in Minnesota. I think Chair Dean summed it up pretty well. MNsure is a crisis for Minnesota families. Southwest Light Rail is not. And the governor was willing to drop everything to fund Southwest Light Rail, but isn't willing to even admit there's a problem to address the crisis that Minnesota families are feeling with MNsure. And unfortunately, it's not even going to be about, can you afford the plan? Can you even get a plan to provide insurance coverage for your family? And that's the problem. I'm back to the question over here. If you feel like you need to put more people into the system to increase the risk pool or balance out the risk pool, capping the plan is not going to solve the problem. And that's the solution that this administration has come up with. They have approved a plan that caps the number of people that go in. And the plan that they approved by capping enrollment is still between a 50 and a 67% increase in health insurance cost for Minnesotans. What would that increase have been if they didn't approve the cap? And if that isn't a wake-up call to the fact that this MNsure is an absolute failure and an absolute crisis for Minnesota families, I don't know what is. But the fact that Minnesota families will not have health coverage on January 1st means that we can't wait until the next session to take action. And this is our wake-up call for the governor to say, hey, we're here, we're ready to roll up our sleeves and get to work to solve this problem for Minnesotans. But Minnesotans who are not going to have coverage on January 1st can't wait until the next regular session.
So to be clear, you want a special session. When, what do you want the timing of?
Well, I want to remind folks that I have been the only one initiating conversations and trying to get a special session called to pass the tax bill and the bonding bill. The governor and Representative Thissen have blocked that. 2 weeks ago, I tried to set up a meeting in person between the 5 leaders and the governor. The governor told me initially it was going to be just Senator Bach, myself, and the governor. The governor told me he wouldn't meet without Representative Thissen there. I said, fine, let's get all 5 leaders there. Representative Thissen would not come to the meeting and would not even give me a time that he was willing to meet. So they are so deathly afraid of having a special session that it might actually show Minnesotans that this government with Republicans in control is working, and that there are people here in St. Paul who care about what's going on in Minnesota, that they're willing to block what the governor said himself is good for Minnesotans because they want to put their own politics first. To me, that's shameful.
Specifically on this.
I have not yet. But in my letter, I raised awareness to him that we need to take action, and we need to take action soon, and that this is a crisis. So,
do you want an immediate solution or an immediate action, or is it better to keep this alive as an election issue?
What I really wanted was a system that worked for Minnesotans, but I didn't get that. Democrats pushed through MNsure, and now we have a crisis. It's not me that wants this. It's Minnesotans that need this. What I want or need is completely irrelevant. This is something that we have to do to solve the problem for Minnesotans. And the governor and his administration burying their head in the sand, pretending like there isn't a crisis, is only going to hurt more Minnesota families.
This doesn't seem like everyone coming together, though, as Chair Dean suggested, is necessary. I don't hear a lot of olive branches here.
We're pretty close. I think we can do this. I actually have a couple ideas on how to make some of this stuff work. It's one thing to criticize, it's another to have some ideas how to get this to work. And you asked a very good question over here. A couple ideas I have. Number one is there's a federal and state rule that says if a company's left, you can't come back in for 5 years. Well, Blue Cross left. They can't come back in for that for 5 years. Get a waiver so Blue Cross can come back in with a plan. That'd be huge. Another very, very important thing to do is set up an MSHA-type risk pool. Now, how that's designed exactly, I've got some ideas. But why not do that? But in regard to the DFL release or whatever you call that thing about how it's the Republicans' fault, it's just so sad. It is just so sad. Go back 4 years and listen to the tapes on my speeches on the House floor and in Commerce Committee. Some are a bit colorful, if you will. But go back and listen. Exactly what I said is now happening. People say, Greg, you're so smart. How did you know that? No, I'm not that smart. But what I do know is basic principles of insurance. You cannot have adverse selection. You cannot dump all the MSHA folks on with the healthy folks and have a system that's not going to go into a downward spiral. Listen to the tapes. In Commerce Committee, I said, this is a scourge upon society and must be destroyed. Was that clear? Did you get that? I said it was a scourge. I said this will be a scourge upon society that must be destroyed. Where are we? Everything I said on the House floor and in Commerce Committee from 4 years ago is coming true now, and the DFL is trying to limp along for 34 days into the next election. We cannot wait till January, because we're going to have Minnesotans on January 1st that wake up with no health insurance coverage. And at best, they go into a substandard HMO plan where they've just lost their doctors, they've just lost their clinics, their prices have doubled. And like I said, I think the point here is you're not going to get 153,700 people into 19,000 slots. That doesn't work. And so not one Republican voted for this, not one. But I am willing to help. I have told DFL leaders behind the scenes, when you're ready, to department heads, when you're ready, I know you're not there yet, when you're ready and you figure out this thing has failed miserably, I'll help you. We didn't create the mess, but we're willing to help clean up your mess.
Chair David, a lot of the issues that you just raised have very little to do with MNsure itself, but with the Affordable Care Act as a whole. So how much are you all limited in what you can do under the framework of the ACA, and how much of this is something that, you know, people in Congress need to sort out?
Well, very good question. That's a very good question. And MNsure is a bureaucratic nightmare that's in the way of something that we already have. We could go to the federal exchange. What, are there 5 states left now that have this impediment, this roadblock like a MNsure in the way, spending $400 million and receiving nothing for it? So yes, you're right, there are separate issues. My ideas are how to help reform the healthcare system, but MNsure needs to get out of the way because they have failed so miserably and they are a disaster.
Chairman, you mentioned you wanted something, bring back a risk pool or something like that. And Commissioner Rothman last week said that he would like that too, but the feds rejected his request for a waiver to keep it when this was being set up, and said he's not certain if that would be allowed today under the terms of the federal law. Times
they are changing, and I believe that as the new president or the current Obama administration wrestles with this, they're going to see that this thing hasn't worked, and they may have to grant waivers where they have said they wanted in the past. I think Commissioner Rothman is exactly right on this, on the risk pool issue. Now, if we set up like an MSHA, or if we have a high risk pool that if you have a health plan and you have over $200,000 of claims, the rest goes in the pool, there's things that can be done there. But I've seen some analysis that if we had that type of high risk pool, increases would be more like 7 to 10%.
Mr. Speaker, can you be clear about the election implications here? Do you think Democrats don't want to touch this because they might not be able to topple you if they do?
I think, election aside, Democrats don't want to touch this because they're embarrassed that it's been such a failure.
But Chair David said they don't want to touch this because of the election.
Well, I think that's part of it. Yeah, it's certainly part of it. I mean, I don't know that the election has much to do with it. I don't know why they're unwilling to fix their problem. I don't know why. I see they just entered the room. You'll get a chance to ask them. But I also want you to ask them, is this a crisis? Is it a crisis that health insurance costs for Minnesota families have doubled? You know, I know one of the reasons that folks said we needed to do this because the rising health care costs due to what hospitals refer to as uncompensated care, where folks didn't have health coverage. They were showing up in the most expensive and frankly probably least effective place of treating their maladies, which was the emergency room. It's interesting now that I've met with those same folks, how many ever years later, and their uncompensated care is actually higher now. And it's not from people coming to the emergency room that don't have health insurance anymore. It's people that can't afford to pay their deductibles. And I think that's one of the things that has been lost in this. The monthly premiums have skyrocketed. Everyone knows that. But I can remember a time just a few years ago when the normal deductible was $1,000. Now a low deductible is $5,000. Folks can't afford to pay their deductible when they're visiting the doctor, and the uncompensated care is actually higher. So what problem did we solve? And I think that's just a great example of what a failure this system has been. MNsure brags that things are working better now. I talked to the plans just recently, and you know, MNsure claims that they're electronically transferring the data now. Do you know what that is? They're emailing spreadsheets that then someone at the plan has to data input. They're emailing spreadsheets, and that's what they call, electronic data transfer. This thing has been an absolute failure, and I'll remind folks that the $300 or $400 million that's been spent on MNsure is a completely duplicate service. We don't even need it, and it doesn't provide anybody with health coverage. It doesn't pay for health insurance for anyone. It simply pays for the bureaucratic layer, duplicate layer that we don't need. And we could start by getting rid of and eliminating that duplicate layer. But we need people who are willing to step up and help us solve the problem. We've put forth some real solutions that will help Minnesotans immediately. They're not going to be the silver bullet or the answer to everyone's problems, but it will be a start. But what I need is a Democrat in the state of Minnesota to admit that there's a crisis and to join us in solving that problem. And that's what we're here to ask them to do today. Thank you.
Thank you.
Hello. There clearly is a problem with our individual market, and we have acknowledged that for quite some time. And so if that's the question that the Republicans want answered, the answer is yes, of course. There's too many families struggling with the increasing costs of premiums and of health care. We also agree that we should sit down tomorrow and start trying to solve this. My question to the Republicans is, where have you been for 2 years? You've been in charge for 2 years, and on the last day, or just about the last day, after session has already ended, you finally come up with some proposals which you think are going to solve the problem. It reminds me of the end of session, where we saw a bonding bill come to the floor 1 hour before the end of session. The Republicans have a pattern of waiting to the last minute and then trying to say, oh man, we have an emergency and we need to solve it. That's what they're doing again. Where have you been for 2 years? That's the question I would ask the Republicans. And the fact of the matter is, we did offer solutions in the last legislative session. The real issue here is that the cost of health care for people in this individual market are too significant because they're either too sick or they can't afford to pay those costs. We got rid of a lot of money that helped this pool in the past. The Republicans aren't willing to put that money back in to help us out. Clark Johnson offered a bill to allow people to buy into Minnesota Care. That would have been a solution that could have worked here. I see that they put out transparency and avoiding surprise billing. You know what? We offered that in the last legislative session. They wouldn't hear the bill. We offered solutions to bring down the cost of prescription drugs, which really is what's driving this issue. They wouldn't hear the bill. So we have been offering solutions. We're willing to sit down and work on more solutions. But the bottom line right now is that we have a Republicans coming up looking and probably knocking on a lot of doors saying, what's going on? My premiums are going up. And they have no answer because they did nothing for 2 years.
I met a woman living in Waseca about a month ago. She and her husband sold their farm out in western Minnesota and relocated. And they get their coverage through Blue Cross Blue Shield. And he's got a condition, so he needs the coverage. And she's scared because they're going to lose at the end of the year their coverage through Blue Cross Blue Shield. We know here in Minnesota that there is a problem in coverage, especially for people in the individual market. But I think we have to look beyond MNsure, and I know the Republicans with each election cycle want to point to MNsure and say it is the problem. I think the problem is more fundamentally with the market and the fact that it costs money to cover people who are sick. And right now, a lot of sick people are in the individual market, and we need to figure out how to spread those costs across the whole system. And when the Republicans are ready to sit down and talk about real cost containment and real measures to deal with the cost of care and ways that we can reform that, I'm ready to roll up my sleeves and do that with them. We have a history in Minnesota of successfully doing that, but it is not going to be coming from a set of talking points that they put on a piece of paper yesterday to try and come back before Minnesotans to say, now we have a good idea to solve this problem that we've seen coming for some time. We have to figure out how to reduce costs in healthcare. And for the people who are facing significant increases, and let me say that about 100,000 people in the individual market who are not getting their coverage through MNsure right now, they're eligible. And they're eligible for the subsidies, which will bring their rates down. So I think the Republicans should join us in making sure that we are promoting MNsure and the subsidies that are available to mitigate the costs for a lot of Minnesotans who are facing high rates. But then I'm going to invite them to join us to have a real discussion about how we drive down costs for prescription drugs, to drive down the rates of coverage, to explore new ideas like a public option that will give Minnesotans a comparison from which to choose. These are ideas that we have already vetted. They're ready to go, and we need to put them before the legislature, and we need to do that soon, and we need the Republicans to join us in that discussion, and I can't wait to see you tomorrow, Speaker Daudt. We can talk about that then. Thank you.
Mr. Minority Leader, are you open to a special session? Are you willing to meet with the governor and the speaker and interested parties on this?
Well, we're willing to sit down anytime they want to start talking about and coming up with solutions. The fact of the matter.
It's a different story that you weren't willing to sit down and schedule time.
Right, we're willing to. I'm willing to sit down anytime to start talking about these issues. But again, here's the fact of the matter. We're not going to come up in 1 or 2 days sitting around a table coming up with a solution to this problem. That's why we had 2 years to deal with it, and we didn't see any solutions coming forward. Again, it's just like the bonding bill. You know, they don't want to involve Democrats. They never want to involve Democrats in these discussions. They launch a partisan document 1 hour before the end of session, and they expect that to be a solution. They're doing the exact same thing right now. They're coming up with a hodgepodge of ideas, most of which won't work, but putting them on the table and then saying, we have an emergency, let's do things right away. And what happened with the bonding bill? We had $1 billion of mistakes. What happens if we rush through this program? We're going to have $1 billion of mistakes. So what I would say is we're willing to sit down and start talking through solutions. We have been for months and months, but I don't think that we're going to get to a special session necessarily anytime soon.
I think people are extremely frustrated who are, their average premiums are going to go up as high as 67%. They're watching this here, and I don't see you coming up with anything. The Republicans have something on paper, but there's no action here. What should they think? This is very frustrating.
It's incredibly frustrating, and I think that that's absolutely the case. And we do have ideas that we put on the table. We have ideas about actually bringing down the cost of health care, making sure prescription, because the reason premiums go up is because the cost of health care is higher. And so we had ideas that we introduced last January to deal with prescription drugs, to deal with the transparency that they put on the table today. That's something that we should start talking about.
I don't think any of that matters to the people whose rates are going to go up.
Right.
I don't think any of that matters. When you did it, when you met, when you didn't meet, what bills you passed. So what's going to happen between now and January?
Well, I think that we have to look at all those issues, but I don't know that we're going to solve this problem between now and January, quite frankly. We need to work hard and come together and sit down around a table. If people can come up with ideas, we're willing to do that. But the bottom line is we need people to have, it's just too expensive for people. And instead of asking money to come out of people's pockets, and instead of having the solution being to subsidize insurance companies, we ought to be coming forward with solutions that actually help help individual families, because that's what the issue is. And if they want to sit down and start talking about that, and there's a solution that we can come up with sooner rather than later, let's do that.
The Speaker says you haven't been willing to meet as recently as a couple of weeks ago about a special session. Is that true?
No, that's inaccurate, and we can look at the text. In fact, the last communication I got with the Speaker to sit down and meet is to ask him, what the subject was, and I never heard back from him. So it wasn't us that weren't willing to meet.
We're all going down a rabbit hole here.
A little bit.
Chair Davids accused you of using the election, that you don't want to talk about this, Democrats don't want to talk about this issue because you have an election in 34 days.
No, we want to talk about the issue, and in fact, we are talking about the issue quite a bit at the doors. This, I don't think, has anything to do with the election, except maybe the fact that the Republicans are finally coming up with a solution after 2 years, because they're worried about the electoral results.
To clarify, I think I heard you say that you don't believe a reinsurance program is a solution. Did I
No,
hear?
no, I didn't say that at all.
Okay, do you think that's enough? That should be on the table?
It should be something that's on the table, yes. I mean, the issue is, where do you come up with the money to pay for the reinsurance program? Again, the issue is the cost is too high. We're asking individual Minnesotans and families to come up with that money out of their own pockets, and then the Republicans are proposing to actually give subsidies to insurance companies. If we're gonna help, if we're gonna have a solution, it's gonna be figuring out ways that we can pool our common resources to help those families and keep their costs down. A reinsurance pool is one of those ideas. But again, it's an incredibly complicated thing, and that's why I wish some of this discussion would have happened earlier.
Representative Thissen, can the House Republican majority do anything without the Democrat-controlled Senate and the governor?
And the Democratic-controlled Senate and the governor can't do anything without the Republican House majority. I mean, obviously.
Is there a lane to go around?
Well, I think this is what you get with gridlock. This is another example of gridlock, unfortunately. Do you have anything you want to add?
I do.
Here, you should step in front of me.
To the question of reinsurance, right? Since I have been in the legislature, we have bandied back and forth between the private marketplace and public programs and what serves Minnesotans best. I was at a door in the district I represent talking with a family, and they are really concerned about the cost of their health care. They've got kids in college. And the woman said, I have read that when you get to 18% of GDP on the cost of health care, it's time to reconsider what you're doing. And she asked me, how much longer are we going to prop up this system, right? How much longer are we going to afford the system? We are spending a lot of money in our entire healthcare system, and reinsurance is a way to subsidize the people who are sick, but it is not a way to solve the underlying problem of why healthcare costs as much as it does. I think it's important for us to think through those families that are bearing the brunt of these rate increases, and we should come up with a short-term way to solve that. But if we do not then follow behind that with ideas, real ideas, to drive down the overall health care costs in Minnesota, we're just going to come back to this again. And by adding ways to subsidize those costs, we're really letting all of the participants off the hook. People who are sick need care. It's expensive. It's growing very expensive for the state of Minnesota, and it's time for us to come up with real solutions like we have done in the past. We did together in 2008 in a bipartisan fashion. Those were good ideas, but they were tough ideas. That's what we need to do, and we can't do that between now and the election or between now and the start of the next session. But that's the work that we need to do with the Republicans, and if we don't do that, we're going to fail the people of Minnesota.
With the tiny caveat that the federal government doesn't look kindly upon an MCHA-type high-risk pool, what do you think about reinstating some kind of high-risk system to take care of this very sick population that's driving up costs?
There are multiple ways for us to consider how to bear the cost of people who are sick. And a risk pool is one way to do it. We did that in Minnesota because people with pre-existing conditions were blocked from coverage. That's why we did that. And we spread the cost out mostly on small employers. I don't think we should do that again. But I do think if we're going to think about the whole of the system and all of its costs, we should figure out how to bear the costs of sick people across that system. Thank you.
Thanks.